Hi, this is Dr. Bob Dannenhoffer with another of our Facebook Live. It's Friday, August 21st, an absolutely gorgeous day. Beautiful late summer day here in Roseburg, Oregon. I'm going to take my mask off. This is one of these purchased N95 masks. They're actually really quite nice. We think that these are going to become more available in the next few months. So this is time for you to ask questions. So go ahead and hit us with anything. We always try to be kind to people. So please be kind with us. And so let's tell us what's going on in the world here. So the world, still a very, very active pandemic right now, 23 million cases and 800,000 deaths. In the world, the case counts are pretty stable. The deaths are rising only slightly. And so this is sort of a quietish time in the pandemic. Unfortunately, we're adding many new deaths and many new cases every day. So this disease is no longer, you certainly could never call it in control. A lot of cases in U.S., Brazil, and India, but also, peculiarly enough, in other places in South America, Colombia, Argentina, and Peru. Places that had this under control for a long time, like France and Spain, and the Ukraine, for whatever reason, are now starting to see a good-sized second wave. So this is a little worrisome to us. If you remember, Europe preceded our big rise. So the concern is that we'll have a rise that will, again, follow what happens in Europe. New Zealand, which went 100 days without a case, has now had a small cluster. So for New Zealand, this seems like a lot, but it's only 69 cases total, and they think they have it under control. The source of that resurgence is not known. Was this maybe asymptomatic spread that finally popped up into symptomatic spread? Was it an import somewhere from somebody who came to New Zealand? Or the other concern is that it's been carried in some other animal, especially cats, and then came back to humans. So we don't know what happened in New Zealand, but they are having a small outbreak there. And really small. So 69 cases is smaller than any state of the Union had. In the U.S., we have 5.7 million cases and 177,000 deaths. So we're really adding on the deaths very strongly. One or 50,000 or 1,500 a day. Still very active in California, Texas, and Florida. But we're also seeing a lot of activity in Georgia, North Carolina, and Tennessee. I think our case rates over the last 2 weeks in the United States is down, but our deaths are kind of flat and unfortunately stuck at like 1,000 deaths a day. Oregon still has very low rates. Although we continue to add rates and the governor is not pleased with how many we're doing, I think the case rate in Oregon is down and the deaths have been steady but still far too high. In Douglas County, we have 169 cases, 152 which are confirmed and 17 which are presumptive. We had our second death this week. We only have 11 people in isolation and 3 people in the hospital. We're only up 9 in the last week, so remember, for us to open schools, we have to have less than 10 per 100,000. There's 112,000 people in the county, so we would have to have less than 11 cases a week. And depending upon what happens tomorrow, we may make it. So that's the good news. Lots of news that came out this week, and we'll do that if we run out of questions, but we'll start here. So Christian says, does the governor announcement this morning nullify earlier metrics allowing smaller schools to open? I don't think so. I listened to the press conference today, but didn't get to hear the end of it. I think her point was that for most of Oregon, we're not going to be open schools unless we really get the rates down, because the rate throughout the rest of Oregon is over 40 per 100,000, and so they're not going to be able to open anything. I don't think it's going to change what happens in small and rural counties. So Melinda says, are throat swabs as accurate as the nasal? You know, we're 6 minutes into this. You think we would know exactly the answer here. So let me tell you what happens with normal tests. So when normal tests come in and they get done, they have to be compared to a bunch of other tests that are out there. So if you're coming up with, say, like a new test for strep throat, you need to compare it to a culture, which is thought to be the gold standard, and then the other kind of strep tests. And you can tell how accurate it is in comparison with others. Unfortunately, when they did the COVID tests, they allowed the COVID tests to be done without those comparisons. And so we really, really don't have a good comparison study where somebody has used the same test, compared nasopharyngeal, saliva, oropharyngeal, and anterior nose. That's what we really need. University of Oregon is doing that study, and hopefully we'll get it soon. But right now, we don't know. What we do know is that all of the PCR tests that are out there, whether they use the front of the nose, the throat, or the back of the nose, are all pretty accurate. But we still think the nasopharyngeal is the most accurate. But until the studies are done, we can't say for sure. But boy, 6 months into it, really should have this data. So this is a question I knew we'd get. Could you speak to why the Mercy Medical Center employees are still considered presumptive? So, and Desiree asked this question. So if in every disease we have, there are some cases which are confirmed and some cases which are presumptive. Big outbreak of norovirus at a restaurant or on a cruise ship. Not everybody on the cruise ship gets tested for norovirus. You know, they test some sentinel groups, and if they have norovirus and it's the same norovirus, they assume that people who are vomiting their brains out also have norovirus, and those cases would be considered presumptive. So in most outbreaks, we have some cases which are confirmed and some cases which are presumptive, even if they test negative. So I've given the example of a mom brings her 3 kids in, one has strep. You see the first one, he's got big red tonsils, a fever, swollen glands, and has a positive strep test. We don't even test the other 2, so in real world, those 2 are presumptive. Even if I did a strep test on the other kid who had exactly the same symptoms and it came out negative, we'd still assume he had strep. So this is the way we do it for every disease. The presumptive cases make up about 10% of the cases, sometimes because people have chosen not to get tested. So we have some cases where there are spouses and they choose not to get tested, or there was one where there was a family member who chose not to get tested. In some cases, there are negatives. It's just the way it is. People really have to get past this. It's just the way it is, and it's like this with every disease, and it really doesn't make any difference. So that's why. So is the rise in the countries that had it under control due to non-compliance with safety measures? Bernadette asks. What we think is, and France is probably the best studied, what happened is as France got their numbers down, they opened up and people began to do more traveling. People began to have more family gatherings. They still had pretty good mask usage, but they did those things, travel and family gatherings, that really led to an increase there. And that's what we're seeing here in Douglas County. It's travel and family gatherings that are doing it. And when I talk about travel, it's not like a random stranger comes to Douglas County to go to the dunes, or a random stranger comes to go ahead and go to Crater Lake. What it is Douglas County people go to another place to be with a sick relative, to go to a wedding or something else and then bring it back, or a relative from another state comes here, or somebody from Douglas County works in another place. So our first death was somebody who went to Texas, got sick in Texas and died. We have 2 now in Texas from people who are working in Texas, and 2 in Louisiana from people who are working in Louisiana. So it's all of those travel things that lead to cases, family gatherings. Yeah, so Bernadette said, can you tell us about the relationship between children with COVID and an increase in type 1 diabetes? So type 1 diabetes is what we've always considered juvenile diabetes. And juvenile diabetes is one of these diseases that we really don't well understand. These are kids who are otherwise well, typically not with a family history, who all of a sudden develop fairly serious diabetes. And it's changed over the years. So in the 40 years I've been doing pediatrics, and I know that sounds like forever, but in the 40 years I've been doing pediatrics, the epidemiology of type 1 diabetes has really changed. So back in the 80s and 90s, the typical story with diabetes is that a early teen would start having troubles and they would be diagnosed with diabetes. Then in the 90s and early 2000s, we saw a lot of really young kids, down to a year or so, getting the diabetes. And it seemed like that they were going to have tons of people with diabetes. But then in the last 12 years, the rate of diabetes is down. There is some concern that type 1 diabetes could be a sequelae of a coronavirus infection, just like this multi-system inflammatory disease in children may also be related to coronavirus. So we don't know about this. This is something we'll study later on if we have time. I listened to a long story today about all of the systems that are affected by COVID, and oh my God, it's long. So Melinda says, so if a family member comes up negative and had a negative throat swab, are they safe to return to society? Again, it depends upon what they had. So if they're a contact with a confirmed case, they really should quarantine for 2 weeks, regardless of what the test results show. If they're not a confirmed contact, if you're feeling better and have a negative swab, then you no longer need to quarantine. So a lot of it depends upon, are you a close contact with a confirmed case? And that's why these presumptive things, people say, oh, well, anybody could have a headache. Yeah, but if you had a headache, you'd never be a presumptive case. You have to have a close contact with a confirmed case and one of the 4 major symptoms. So on Melinda, if you could be clear on that, we'll know. Yeah, so Melinda says, can COVID be carried by pets and then infect people? We do not know. We know certainly that pets can carry it. We know that cats, especially the great cats, can carry it. There was in the zoos in New York City where the great cats got this. What we don't know is, can you give it to the cats spread it around, the cats don't get very sick, and then you pick the cat up, and can the cat give it to you? Do not know the answer to that. And again, that would be a real concern, because then it would be really hard to eradicate if this widely spread in the cat population. So why do we test people who aren't sick if tests are inaccurate? Why not only test sick people? Well, that's what I would recommend. I would recommend that we really only test sick people. So that's what we should do first. So the testing strategy should be, we first test sick people or people with symptoms who are part of the contact. Once we do all of that, and we know that in most of the world we haven't done all that. Actually, in Oregon, we have one of the highest rates of finding our cases. So let me give you the story on that. So in Oregon, we think about 40,000 people, based on antibody studies, have had the disease, and we found 23,000 of the 43,000, so a little bit more than half. In New York, they did very extensive antibody studies of people in New York. So there's 8.5 million people in New York. 27% of those were positive. And it varied. Some areas was over 30%, some areas was 10%. But overall, 27% were positive, which means they had 2.3 million cases of the disease, but they only identified 236,000. So they only identified about 10% of the cases. And again, that's not surprising, because at the time New York had its big blow up, they didn't have enough testing. People were really frightened they weren't going out to get testing. And so they only found out about 10% of the cases. So again, remember, Oregon finds about half of their cases. They only found out about 10% of their cases. But they did know that of the 236,000 who were identified, there was about 10% of them died. And so the case fatality rate, that is of people who were diagnosed, how many died, it was 10%. But the infection fatality rate, if you took that bigger group of people who had positive antibodies and presumably indicated everybody who was infected, it was about 1%. So the infection fatality rate, we've talked about over the months. Some people say it's 1 in 1,000, or it's 1 in 10,000. It's not. In this area here, it was about 1%. I think the right number is going to come out somewhere between 0.5% and 2%. So that would be 0.5% or 2% of the people get the disease dying. This is pretty high. So Heather says, do you think we'll be shut down again? I don't think Douglas County will be. Douglas County, again, we have one of the lowest rates in the country. So again, if you look at these maps that look at the hotspots, Douglas County is cool. And so we're not a hot spot. Now, could it happen? Absolutely. We could have a super spreader event, and we'll talk about those too. We could have a super spreader event and have 100 or 200 cases. And so we do want to be careful. But right now, Douglas County is doing very well. Yeah, so Kendra says, are you seeing any new promising research for prevention measures such as vitamin D or treatments? No, in fact, I went to a long conference this week about vitamin D, and very clearly that people who have low vitamin D levels seem to be more at risk for many diseases, cancer, depression, everything else. However, it may be because those people tend to spend more time inside because they're sick or depressed. And that's why it is. There's some really good studies that came out this week that showed that supplementation with vitamin D doesn't seem to prevent these diseases from happening. On the other hand, getting adequate amounts of vitamins is relatively easy to do with multivitamins. And so if people want to take multivitamins, that would be great. Okay, so let me go through the diseases, the areas that are affected. So on this skin, starting from the outside, starting with the skin, there are some rashes that people have gotten, most prominently the COVID toes, which sort of looks like frostbite on your toes. Second one has been hair loss. And so it's not uncommon for people to lose a little bit of hair with illness, but apparently people are losing like all of their hair with this. That's worrisome. Neurologically, we're starting to see changes in memory and attention and performance on neurocognitive tests. So neurocognitive tests might be like connect the dots or something like that. And we're seeing a real decline there. We're having people with nerve palsy, so foot drop. So your perineal nerve is the one that helps you lift up your foot as you walk. And apparently perineal nerve palsy has been seen. The heart is perhaps the most worrisome. So not only are people getting acute problems like acute heart failure, but we're seeing myocardial inflammation in a lot of patients, even in a lot of patients who did not have much disease to start with. And that's really worrisome. So for those of us who like baseball, the Boston Red Sox, Eduardo Rodriguez, who's their pitcher, apparently is so disabled from his COVID infection and his myocarditis that he's basically going to miss the season. And then there's a college athlete and a couple of others in sports that are going to miss the season because of heart disease related to what was not a particularly serious COVID infection. Long-term respiratory symptoms, so they've looked at people after hospital discharge, and then they've done chest imaging, spirometry, and other things. People complain that they still feel short of breath. Their pulmonary function tests are not nearly back to normal, and their chest x-rays and other imaging is not nearly back to normal. So the question is there going to be long-term lung damage? I don't know how long-term, but at least in the midterm, which is a month after discharge, the answer is very definitely. The chronic diarrhea has been really an important and an interesting thing. We have had a couple of patients here with really bad diarrhea. This is not like just a little squirts here. This is really bad diarrhea that goes on for months. And so we've seen that. Kidney disease, about a quarter of the patients who get hospitalized are going to wind up with some kidney injury, and many of them are going to wind up on dialysis. That is really, really bad because dialysis is such a life-changing event. Changes with conjunctivitis, so kind of conjunctival injection, not really an infection, but kind of redness, and then long-term smell changes. So, we've noticed short-term that people lose their sense of smell and taste, but apparently for some people this goes on for a long time. So almost every system except bone, I think, is affected by this, but really serious. And that's the worry, that as we have more of this disease out there, that it's not just, well, I got this and I was better, but if you're Eduardo Rodriguez, now you can't play sports anymore. If you're the quarterback who can't run anymore, this really could have lots of long-term effects on people. So Sherry says, I've been seeing things that getting a flu shot increases the chance of getting COVID. Is that true? Absolutely not. So there's no suggestion either way that either the flu shot will protect you against getting COVID or the flu shot will make you more likely to get COVID. So Sherry, if you've seen that, why don't you send that to me and we'll take a look. Now, not surprisingly, more older people get the flu shot than younger people. It's so hard to convince the 25-year-olds to get a flu shot. It's like, oh, I'm kind of invincible. So not surprisingly, more 70-year-olds had the flu shot last year than 25-year-olds. But that there's no connection with people who got the flu shot being more at risk than similar people who did not. Yeah, so Sarah says, why isn't more antibody tests being done to give a clearer picture of how it spread? Well, there is actually a bunch of antibody tests. Oregon completed their study. New York completed their study. So antibody tests are most useful to be done in a studied population. If it's just like, hey, you want to get an antibody test, you may get people who are different than the general population. So when Oregon did their study, they get a wide-ranging population, about 1,000 people. New York got lots of people. I don't remember how many, but thousands and thousands of people in their antibody studies. So yeah, antibody tests are being done. If you want to get an antibody test, that's fine, but the antibody tests to show spread actually are being done. And it's showing, not surprisingly, that areas that seem to have a lot of disease had a lot of disease. Areas that seem not to have a lot of disease, like Oregon, didn't have a lot of disease. So it's confirmed kind of what we thought. So did the presumptive cases at Mercy have symptoms? Yes. The only way you can be a presumptive case is if you have one of the serious symptoms. So headache, sore throat, those didn't count. You have to have fever, cough, and a new cough, not just a little cough. Fever, significant cough, shortness of breath, or loss of sense of smell or taste. A bunch of them had loss of sense of smell or taste. That is such an unusual symptom, and that's why they were considered presumptive. So Heather says, do you feel confident about children going back to school as a pediatrician? Well, pediatrician, father, grandfather, yes, I do. And if we can have the rate of disease low, and I think less than 10, I'm very comfortable with kids going back to school. Great story today on the radio talking about a place in rural Maine that started back in school. They've done fine. There's small classes. There's not a lot of disease in the community. They've done just fine. Other countries, when they've had low rates of disease, they've done just fine. However, when you start school when there's a lot of disease, so remember last week we talked about Valdosta. So I've been looking at the Valdosta newspaper every day, and a big headlines here, Valdosta school's closing because 7 kids had it, and all this drama that happens. Well, not surprising that you're going to get kids with the disease when you have a tremendous amount of disease in adults. So again, if we can get the rates down, I think opening schools is a great thing to do. So Kat says, are we doing follow-up to see if people are long haulers? Yeah, we have a couple of long haulers here. And these are people who really are taking a long, long time to get back to normal. So yeah, we are doing those follow-ups. So Amy says, is it true that a positive antibody test is added to the confirmed count? Absolutely not true. So we only have 5 positive antibody tests. Some of those are in people we knew had the disease. But if you only have a positive antibody test and no molecular test, you are not part of the case. We only have a few, though, that are in that group. They probably had the disease. So we have one family that early on had a good story for the disease, but it was back at the time we weren't doing testing, so they didn't get tested with a molecular or PCR test. Later on, they had antibody testing, were positive, so they probably had a case that was not counted on the confirmed. So just when we look at this number of cases and people are fretting over the exact number, there are probably some of those cases we didn't count because we didn't have testing at the time. And then some of the presumptive cases may not actually have had it, but it's going to be impossible to separate those out. And so we just have to say the numbers are kind of the numbers. Now, we wouldn't expect that the presumptive issue, the false positive issue, the false negative issue, or the didn't have enough testing at the time would be materially different between areas. So rather than focusing on we have 169 or 163 and a half cases here, really it just gives you sort of an idea of where you're at. And again, since about 90% of our cases are confirmed, I don't think we have to worry too much about that. Yeah, so Desiree says, what can we do about businesses not wearing masks? So for businesses, OSHA enforces those rules, but I don't think they're being really strict about it. And again, when people are not wearing masks, there could be other reasons people are not wearing masks. Maybe they've had a traumatic event or they medically can't wear a mask, in which case we would have them wear a face shield. And again, I think masks are really important. I think hand washing is important. I think cleaning surfaces is important. But again, the big things, people from Douglas County traveling to another place for a family gathering and then coming back, or people from another place coming to Douglas County for a family gathering. This is where we've seen the spread. So while I think masks are important, the travel and the family gatherings, the most important. Yeah, so Crystal said in the press conference, the governor talked about a fine. Does this mean our local police are enforcing this? Again, I didn't get to see the end of the conference, but I don't see that happening in Douglas County. But the story is, look, we don't want to go to fines. We don't want to go to writing citations and that kind of stuff. That's not what we want to do. We want people to do the right thing, wear a mask, be careful about travel, and so that we don't have to. Yeah, so Amy says, what are the chances of school yo-yoing in and out of school due to illness? Certainly a possibility, and certainly much more a possibility if the background level of disease is high. So if you have background disease level of disease is high, like it was in Indiana and Georgia, they were yo-yoing in and out. Start school one day, now everybody's out, in for 2 weeks out, and that's going to happen. With low rates of disease, we don't think we're going to have very many cases in school. And so the hope would be, schools would be open a week or two in. There's one kid who has it, got it from their parents. One small class would shut down, no drama. They'd do distance learning for 2 weeks. They'd be back in school in 2 weeks, and that would be it. The concern is that if there's a lot of disease, you get like these schools in Georgia where like 1,000 kids are quarantined. That's a disastrous situation that we really, really, really want to avoid. Okay, so a couple of studies that came out here. One is about these neck gaiters, and I'm not wearing my neck gaiter today. Remember, there was a study from Duke University a few weeks ago that looked at a way to show the spread. They tested one person who had a very sheer neck gaiter, and it didn't seem to stop much. Unfortunately, what people took from that is neck gaiters don't work. So then people did the studies, and they looked to see. And it really talks about how many layers you have. So if you just have one thin sheer layer, and I saw somebody the other day with one, and you could see everything, so probably wasn't stopping much. But once you get to 2 or 3 layers, it works pretty well. So all of the neck gaiters I have, my wife has put 3-layer mask behind the gaiter. So there are 4 layers, so they should work fine. So Heather and Steven, so thank you. So a couple of things came out this week. One disappointing was about convalescent plasma. So convalescent plasma is the plasma that people who've had the disease, have levels of antibodies, have. They donate their plasma. And again, I'm really big into blood donation. They donate their plasma and then it's given to somebody who's got the disease. And this has been thought to be very useful. It's very useful for many diseases. So the Mayo Clinic has been leading the study. They've done 20,000 people, and they show that it's very safe, so we don't have lots of side effects from the convalescent plasma. Unfortunately, we're not seeing a lot of positive signals that it really works. And that's concerning, because after 20,000, if this was working, it should be crystal clear that it was going to work. Still not clear, and so the FDA says we need more studies before we approve it. That is disappointing. They've given it to 2 people, and they said, well, we can't really tell for sure. But at 20,000, it's disappointing that the effect isn't more. The second thing that came out was remdesivir. There was a nice double-blinded study. Well, a blinded study, wasn't double-blinded, but they gave some people 5 days of remdesivir, some 10 days of remdesivir, and some a placebo. The people who got 5 days of remdesivir were a little bit better than the placebo group, and the 10 days were about the same as the placebo group. So remdesivir did not help all that much. Not a big difference in mortality, not a big difference in hospital stay. So disappointingly, remdesivir less effective than we'd hoped, and convalescent plasma similarly less effective than we hoped. There was a question earlier today from Vanessa, so we would get that too. So why are we not hearing about the numbers that are hospitalized? I think we've been saying that every day. So if you look at the daily update, I'm pretty sure it's there. In any case, we have 3 in the hospital today. And so the hospital numbers are a little also confusing because there are people who are out of state who are in hospital in Oregon. And then we've also had people from Douglas County who are in the hospital in other places, especially Eugene and Portland. And we had at one time somebody who was from Douglas County who was hospitalized in Texas. So I think we say that every day on our release from the task force. Okay, well, you come up with that other question. There were a couple of other things that we came here. These are my books here that have all my stuff. One was about what we should do for seniors. So I've spent a lot of time this week talking with people who are at Senior Center and other places about what they should do. And the concern on seniors is that when they get this disease, they tend to get much sicker than others. On the other hand, we're beginning to see that the long-term isolation that people have had, the long-term of not seeing friends and whatever has really been problematic. And so we're really struggling for how we open things again for seniors. One of the things that came out this week was about super spreader events. And so we've talked about this before. So most diseases are kind of predictable. You get the flu, you're probably going to give it to almost everybody else at home, but you're not likely to give it to somebody on the other side of your class. And most people who are contagious to a few people. Now, there's occasionally somebody's got the flu, doesn't give it to anybody else. Somebody with the flu will give it to 3 or 4 people. This disease, COVID, is so weird in that a lot of people don't give it to anyone. So we have a bunch of cases where somebody has it and nobody else in the family gets it. I mean, nobody, zero, else in the family gets it. And you say, that's weird, right? So few diseases, would you not give it to your spouse because you're always close and your kids are always close? But in this case, we've seen that. On the other hand, what we've seen is cases where one person can give it to many others. So there's this choir in Seattle where one person gave it to over 50. We have this case in Seattle from this Dynasty fishing boat that went out where presumably one person, because they were able to do the genomics, the one person gave it to over 100 people on the boat. I mean, there's no other disease like that, right? So even measles, which is one of our most contagious diseases, doesn't seem to do that. So the super spreader events are a concern, and they're a concern because you could have a dozen funerals. And on the dozen funerals where there's not a super spreader event, there's not going to be any cases. But in the one where there is one super spreader there, almost everybody at the funeral or everybody at the craft show or everybody in the class could get it. And that's why these events, especially events with seniors, are the most concerning. Because again, if we had a lot of seniors get sick at one time, we could wind up with lots of hospitalizations and several deaths. Did you find it? So Vanessa had a question this morning. Couldn't find it. Okay. Well, if somebody asked a question this morning, and if we didn't get to it, we'll get to it next time. All right. Any other questions? All right. It looks like we have done well. It's a beautiful day outside. I encourage people to go home, get outside, enjoy the beautiful sunset we're likely to have tonight, and get a walk. Really, one of the things we're seeing is that people are exercising much less this year than they were before. Some of it is because we're not having organized sports. Some of it is that we're not having things like races that people are preparing for. And some is that gyms are now required to wear a mask in the gym. So I did go to the gym earlier today and wore my bike helmet face shield, which I know looks weird, but it was perfectly fine and I was able to do that. So people are getting a little less exercise. So if you can't get the exercise at the gym or in organized sports, please go out and get some activity, and a walk is a great way to do it. Other thing we would say is be really careful about travel when you go to another place and come back, or if somebody from another area is coming here. So what could you do to make that safe? So grandma wants to come visit. So what could grandma do to make it safe? Well, if she quarantined for 2 weeks before she came to visit you and traveled in a safe way, this would be very safe. However, if she leaves Idaho, comes over here, drives for a day, comes here, and there's a lot of disease in Idaho and she's not quarantined in Idaho, she could bring that back here, and if she's a super spreader, could really do it. So we have, for example, one case where there's one person and then it's several generations, probably 20 people they subsequently infected. So it really is a weird disease because there's no prediction of who these super spreaders are going to be. In the choir, it was we don't know the age of the person, but it was an adult person. In some cases, it's a teenage kid. We've seen in some of the ones in Germany, there was a bartender who spread it to a zillion other people. And so it's unpredictable who these people are going to be, and that's why we need to always be on our guard for these super spreader events. Again, these super spreader events are most likely to spread when there's a lot of people there. So if this fishing boat only had 12 people on it and 85% got infected, there'd only be 11 infections. When there were 122 people on this boat, fairly closely together, there was a lot of infections that came out of it. Now, interestingly, many of those people were asymptomatic, which is good, but still, there were a lot of infections, and there was some bad disease. In fact, the ship needed to turn around because there was somebody sick enough to be hospitalized. All right, well, that's what we got for the night. I see no more questions. Thank you all for doing this, and we'll do this again next Tuesday. Thanks.